Hello everyone. In this video, we will talk about pathological fractures. So a pathological fracture is a fracture that happens in a bone which has been weakened by a disease. So what happens is some systemic diseases can lead to weakening of the bone. And if such a bone gets fractured, that fracture will be called a pathological fracture. For a pathological fracture, you don't need to have a major degree of trauma. Even a trivial or a small trauma would be enough to cause a fracture. Causes can be divided into localized or generalized causes. Localized causes means that there is a disease which is limited to one particular bone. Whereas in generalized causes, they affect all bones, and so all bones are weakened due to the disease. Examples of localized causes include inflammatory causes like pyogenic osteomyelitis and tuberculous osteomyelitis. Then there could be a neoplasia in a particular bone, like a benign tumor, like a giant cell tumor or an enchondroma, or malignant tumors like osteosarcoma and Ewing sarcoma. Also, metastasis from lungs, kidney, breast, and prostate may weaken a bone and make it prone to fractures. Apart from that, simple and aneurysmal bone cysts also leads to pathological fractures, monoostotic fibrous dysplasia, and polio disease, which causes bone atrophy. Generalized causes or diseases which include all bones include hereditary causes like osteogenesis imperfecta and osteopetrosis, acquired causes like osteoporosis, which is the most common cause for pathological fractures, osteomalacia, rickets, and scurvy. They also weaken all bones and can cause pathological fracture in any bone. Then there are malignancies like multiple myeloma, which affect multiple bones. They cause lytic lesions and they make the bone prone to fractures. Next is Paget's disease, and then polyostotic fibrous dysplasia. Remember, polyostotic fibrous dysplasia is a part of a syndrome called McCune-Albright syndrome, in which, apart from the bone problem, we also get cafe au lait spots on the skin and precocious puberty. A diagnosis of a pathological fracture is made when we see that there is a history of fracture without any significant trauma. So like I said, the trauma will be very trivial and the patient presents with a fracture that should give us a suspicion of the fracture being a pathological fracture. There might be some discomfort in the bone before fracture. The disease has to be diagnosed in this case. The main treatment is done by detecting and treating the underlying cause. Since it is the underlying cause that has made the bone weak, the cause has to be eradicated so that the bone eventually can heal. And the capacity of the bone to reunite has to be assessed. That depends on the cause of the pathological fracture. So if the fracture was due to Paget's disease or osteogenesis imperfecta or osteoporosis, the fracture usually reunites with conventional methods. Whereas in a benign tumor or a bone cyst, the union can be delayed sometimes. In conditions like osteomyelitis, the fracture takes a very long time to heal. Whereas in metastatic bone cancers, the fracture may either not unite at all or it may have a chance of uniting if the disease is controlled by chemotherapy or radiotherapy. To accelerate the union process, bone grafts can be used.